BBC News, Accra.
Let's discuss this further. Joining me live from Accra is Kojo Oppong Nkrumah, the Ghanaian Information Minister. Thank you for speaking to us this evening on Focus on Africa. First off, we must say that you've had a number of recoveries in the country. How have you done that? How have you been treating COVID-19 patients?
I think with the benefit of time ahead of us, what we did was to put in place an elaborate system for tracing and testing, so that when we find positive cases, we're able to aggressively, through the Ghana Health Services, provide the necessary level of treatment. They have a number of drugs and protocols that they use to treat persons who have tested positive. So it's that aggressive response early on that has enabled us to have at least currently about 49 people who have been discharged to go home and have an opportunity to be managed from home, and 3 persons who have fully recovered. What that means is that they have tested negative now after a series of tests after treatment. About 108 persons are also responding very well to treatment.
Could I just push you on the fact of the testing? Are you saying that Ghana has more than enough test kits?
Enough is relative. We have a target of about 50,000 test kits that we desire to bring in. Currently, we've got a little over half of that in the Ghanaian jurisdiction, and the rest is coming in the coming days. But what we've done is to set up an enhanced testing program. Our strategy is to be ahead of the virus and not to be chasing the virus. What that means is that for persons who are contacts of older persons who are affected or who are tested positive, persons in what we call at-risk populations, we are going into these communities, engaging people and having an aggressive testing program, which is what we believe will help us identify as many as possible positive cases that are out there, and then very quickly deal with it to bring our curve down.
And in terms of tracing, contact tracing, I mean, we've seen the more extreme measures that have been taking place in Singapore, for example, using mobiles and data, people's data. How are you contact tracing?
We're using a mix of the traditional contact tracing, where a positive person tells us his history in the last about 4 or 5 days, and through that history you're able to plot the persons that they've been in contact with. So that's a traditional method on one side, and a bit of technology as well. With the benefit of technology today, maybe not necessarily using some of the enhanced data options, but triangulating through cell sites, you're able to tell where these persons have been over a period. So it's a combination of these options that is helping us to identify persons who we believe are at risk, and therefore engage them to be tested, or if necessary, have them self-isolate for observation.
Now, I know that Ghana works very closely with the WHO, and they're really keen on building resilience in nations' health systems. How many ICU units have you got? Because so far it seems that, you know, you have had patients who've recovered, but let's just take the worst case scenario. ICU units, ventilators, how are you doing?
So suffice to say that currently we do not have any persons in critical condition. Our audit that we have done puts us close to about 200 ICU units between the public sector and the private sector, should we have need for that. We have placed an order for an extra 50 to be quickly brought in, particularly in terms of ventilators and fitted in some of the wards that we believe can be upgraded. In addition, we have just rolled out a national ambulance service, which has ambulances that are equipped with ventilators, about 307 of them, but those are not ones that you intend to necessarily use for full-time care. Those are for transporting people up and down who may need. So we continue to observe our logistics status, and if need be, work to ramp it up.
Okay, Minister Nkrumah, fascinating. Thank you very much for sharing your country's experience. Thank you.